Dr. Marshall Isaacs. It's good to see you virtually. It's been a couple of weeks. I trust you're all faring well and staying safe. I'm going to spend just a couple minutes talking to you about face coverings. As you all know, both the CDC and the county have issued recommendations that when we are out in public or at any essential businesses, that we cover our face with a cloth or other type of mask. So I thought I'd go through with you what those are. And I want to start with the N95. So there's different types of N95 masks. And they don't all look like this, but whenever there is an N95, a healthcare worker will know because it's marked as N95 in very small print that you wouldn't be able to see. But this is the standard for what healthcare workers, including our first responder, paramedics, and firefighters, are using out in the field or in the hospitals to protect themselves from exposure to the coronavirus. And without getting too technical, the N means that it's not impervious to oil. That doesn't really matter in the healthcare setting. So you can just ignore the N. And the 95 refers to its ability to filter particulates that are in the air. And again, the CDC recommends that this is the level of protection that healthcare workers should utilize in a healthcare setting. And that 95 indicates that filtering mechanism built into the N95 masks can filter out 95% of all particulates, including viral particles that might be in the air. The other type of mask that we hear about frequently is a simple surgical mask, right? And this is much flimsier and comes in lots of different colors, but essentially it's a medical grade mask, all right? And it has these simple ear loops, and you place it over your nose and mouth and then your ears, and it often has a little piece of malleable metal that allows you to press it down over your nose and nasal bridge and allow it to be more snug. And these are simple barrier masks. They do not have a filtering mechanism within it. And these masks are used by healthcare workers for very low-risk patients. They don't have a filtering mechanism. They simply act as a barrier. And then what's available all over the internet and in some stores, if you can get to them, are what we refer to as simple cloth masks. And these come in a variety of styles and fabrics. This is just one that's available, and you can look super goofy in it, and you simply place it over your nose and mouth, and then the ear loops go over, and then it becomes impossible to hear anybody talk, right? And these are what are recommended for the public or essential workers to have when out in public today. And it doesn't matter if there are the ear loops or ties that you can tie behind your head. What's important to know about face coverings in public are that whatever you choose to use, it should fit snugly but comfortably. It should be secured with either the loops behind your ears or ties. It should allow the person wearing it to breathe comfortably. It shouldn't restrict anybody's breathing, right? It should have the ability to be laundered so that after you've been out in public, you can either discard it if it's a throwaway mask and you have ample supply, but better yet, if it's a cloth mask, simply throw it in the washing machine, and that wash cycle should take care of cleaning that simple cloth mask. It's also important to note that these simple cloth nose and mouth coverings are not a substitute for all the other things we're recommending. They're not a substitute for social distancing, hand hygiene, and simply staying at home when you're able to do that when that's appropriate. So why the difference? And I get asked this question all the time. And I think it's important to remember that a simple cloth mask is not technically meant for the individual wearer's protection. So you wearing a mask doesn't completely protect you, right, from being exposed to virus out in public. What the mask is doing is protecting others from you. So in other words, if you are asymptomatic and have the COVID virus, all right, or you're pre-symptomatic, hope not, but if you're about to come down with symptoms, hopefully mild, but you have the virus, right, the mask acts as a barrier to respiratory droplets that come out of our mouths and sometimes nose when we're simply talking, and certainly when we're coughing and sneezing. So the mask protects others from coming in contact with our respiratory droplets. If everyone out in public is wearing a mask, then nobody should come in contact with others' respiratory droplets and therefore the coronavirus. So I've read a good analogy, I think it was in the Atlantic, that talked about if you have a campfire and embers start to escape the campfire, and you think of the embers as the virus, right? The mask keeps those embers from traveling out into the forest and starting other forest fires, or in this case, infecting other people, right? And that is the purpose of these simple cloth masks, to prevent your respiratory droplets from coming into contact with other people's mouth, nose, or if those droplets with virus particles land on surfaces, from us touching those and then contaminating ourselves by touching our nose or mouth. So that's the basic science behind cloth masks. The reason that healthcare workers use the higher level of protection is because not only do those provide the barrier that we just talked about, they also filter 95% of particulates that might be in the air, thereby protecting our first responders and our healthcare workers. So I'm happy to answer any questions any of you might have about this or any of the other items regarding first responders and efforts we're doing to continue to provide the highest level of service to the people of Dallas while protecting our first responders and maintaining the operational capability of the fire department.